Good afternoon, everyone. First of all, thank you for inviting me to this conference. My background is very different. I'm a bioengineer, so I do not do needle injections or any procedures. But what I wanted to talk about is some of the basic science research that is going on in ultrasound. That's what my lab does, and to see what the future holds in terms of not only 3D and 4D, but also other technologies. So see if I can advance it. So I do not have any disclosures. I will talk about a few commercial products, but I'm not endorsing any of them. I do not have any financial affiliations with the companies. So I'm going to briefly talk about the current state of the technology, and then talk a little bit about the utility of 3D and 4D for needle guidance, and then talk about some of the other alternative technologies that are out there. So I want to begin with some basic concepts of the conventional 2D ultrasound scan plane. Now, most of you probably do ultrasound-guided needle injections and so forth. But one of the things that is very important to keep in mind is that the ultrasound imaging plane is not infinitesimally small in terms of the thickness. There is a finite thickness associated with the ultrasound beam. The thickness is in the elevational plane, in the plane that is along the thickness of the transducer. Oops. And that is important because oftentimes out-of-plane artifacts can confuse where the needle is, for example. Conventionally, we use arrays for focusing, so the ultrasound beam has a waist. You can see that where the focal zone is. Now, the focusing only happens in the lateral direction. There is hardly any elevational focusing. Apologies. There is hardly any elevational focusing. So this causes some out-of-plane artifacts. Having trouble. Okay. So how do we do 3D imaging with these kind of arrays? So there are two conventional technologies. One is using a mechanically swiveled transducer. So it's a conventional linear array transducer, for example, or a curved array transducer that is mechanically swiveled in the elevational direction. So you get a stack of 2D planes, and you can reconstruct a 3D volume from that. Recently, for cardiac imaging, there's been matrix array transducers that have been developed. These have a two-dimensional array of transducer elements, so you can actually now focus in the elevational plane. This is something that was not possible with the conventional 2D imaging methods. Now, the pros of using a mechanically scanned array is that it's relatively inexpensive. Nowadays, there are some high-frequency transducers that are available, going up to 14 megahertz, which could be suitable for the kind of applications that you are used to. The matrix transducers currently are primarily for cardiac imaging. They use low-frequency transducers. So high-frequency matrix transducers would potentially come in the future, but they're currently not available. The cons of using a mechanically swivel transducer is that it's extremely bulky. These are large transducers and somewhat cumbersome. They also produce near real-time imaging, but the frame rate is rather slow. So the volume update rate is rather slow with these transducers. You can get much faster volume update rates with the matrix transducers, but they are expensive. They are orders of magnitude more expensive than the mechanically scanned transducers. Oops. All right. So there's another technology that was initially used for many years before these mechanically scanned and matrix transducer were available. Basically, these technologies used a position sensor that was often an electromagnetic position sensor, often an optical position sensor. So these position sensors would be attached to the transducer. There would be some reference. In this case, in the electromagnetic position sensor, there would be a reference transmitter. And then the system would allow you to identify where the ultrasound probe was in 3D space. So based on that, you can reconstruct a three-dimensional volume. This was used for almost a decade before the introduction of the conventional real-time 3D transducers that are available now. But this technology does not produce real-time imaging. So it produces three-dimensional volumes, but not four-dimensional imaging. So the problem has always been, once you get these 3D volumes, how do you visualize it? One standard way of visualizing it is using these multiplanar reconstructions. So you can visualize a transverse view, a longitudinal view, and a sagittal view. So for example, in this case, we're looking at the ulnar nerve. You can look at the transverse view, the coronal plane or the C plane, and the longitudinal plane, and so forth. Now, when you're doing real-time imaging, you have to imagine where the orientation of the transducer is relative to the orientation of the body and the orientation of these planes. In real-time 2D imaging, it's hard enough to imagine where the plane lies with respect to the transducer and the body. With 3D, now you have one more degree of freedom. So visualization is often problematic. So this is another view of a multiplanar reconstruction from a freehand tracked 3D transducer. So this is using a position sensor. You can track the transducer over large distances. So for example, this is a view of the forearm. You can see a sort of panoramic volume of the entire extent of the forearm. So this is not real time. This is just an offline reconstruction. So specifically for needle injections, so what is the utility? Now, most of you know the problems with using conventional 2D. The orientation of the needle with respect to the transducer is very important. If you are at an angle, the strength of the echo is going to be much smaller. If you're off axis, it is very difficult. If you're looking at the needle in a transverse plane, it's difficult to locate where the origin of the needle is, or the tip of the needle is. So these are standard problems with 2D imaging. So now the question is, does 3D help solve these problems? Now it seems potentially useful because you have now one more degree of freedom to visualize the needle tip. So for example, in this article, they showed the visualization of the needle tip, even though in the conventional 2D image, it was hard to see the tip of the needle. You can see the proximal part of the needle, but the tip of the needle is underneath the nerve, and it's not visible in this plane. But with the 3D image, the plan view, you can actually see the tip of the needle underneath the nerve. So potentially 3D could be useful. The other way of visualizing the 3D images is what is called volume rendering. So in this case, you try to see a full volume visualization of the tissue and the needle. So this is another image from an article. This is I believe, a femoral nerve injection. It's very difficult to visualize where the needle is and where the nerve is. And the problem is that the contrast between the nerve and the surrounding tissue is very low. So conventionally, 3D and 4D imaging has been very successful in applications where there is a very high contrast between tissues. So for example, in fetal imaging, it has been very successful because there is a strong contrast between the amniotic fluid and the fetus. But in a situation like this, where there is very low contrast, the utility of volume rendering becomes much less. In my opinion, a bigger problem is trying to understand the orientation of the volume with respect to the anatomy and the transducer, and especially if you have another needle in place. So that 3D geometric transformation sometimes is very non-intuitive. So this is my summary of what I see as the pros and cons of 3D and 4D. The pro, of course, is that it could potentially improve the visualization of the needle tip with respect to nerves and other anatomy. The cons is that primarily the visualization is very difficult. It can be very time-consuming. You can oftentimes spend more time trying to understand what the volume is with respect to the needle and the sorry, I'm having technical trouble with this. Don't seem to be able to go back. Okay. So it can be time-consuming. The 4D imaging is slow, especially when you're using mechanically scanned transducers compared to real-time imaging. The image resolution is quite poor. As I said, the elevational plane is not focused. So the elevational resolution is always going to be significantly lower than your axial and lateral resolution. And so even though you can visualize the plan view of the C-plane, the resolution in that plane is going to be quite poor. High-frequency 3D transducers currently are mechanically swivel. They are not really the matrix transducers. Matrix transducers are potentially able to do real-time imaging, but they're expensive. So what are some alternatives? Well, one possibility is to use a position sensor on the needle itself and track the needle with respect to the ultrasound imaging plane. So this is a technology that Ultrasonics has been pursuing. There are several other companies that have been pursuing a similar technology. So again, using these electromagnetic position sensors, you can track the tip of the needle and provide a cartoon showing where the needle tip is. Another technology uses a vibrating needle. It's a piezoelectric vibrating needle, so you can use color Doppler to visualize the needle much better. Another possibility is to use what is called spatial compounding. So instead of looking at the ultrasound image perpendicular to the transducer face, one can steer these ultrasound imaging planes in multiple directions and then produce a compound image. So this is, again, available from some vendors. Needles are often etched to improve their visualization. So there are other attempts to improve the visualization of the imaging plane. These are some novel visualization methods that are being researched right now. So this is a technology from Pittsburgh. They use this half-silvered mirror to try to visualize the ultrasound imaging plane with respect to the anatomy, so that when you're looking down at the anatomy, you can actually see the ultrasound imaging plane superposed on it. This is a technology from University of Virginia that use what is called a C-plane ultrasound using a portable system. You can actually see the imaging plane underneath the scan head. This is primarily being used for vascular access. Now, of course, these are novel technologies, but the trade-off is a significant loss of imaging resolution. So these images will not be anywhere near the high-resolution B-mode images that you might be used to. The previous speaker mentioned fusion. This is, again, being researched. Some vendors provide the capability to do this. Fusing ultrasound with preoperative MR and CT images using these position sensors for registration. Again, I agree completely with the previous speaker's comment that this is probably going to be very cumbersome for routine use. So in summary, the technology has improved significantly over the past decade. It's going to improve significantly over the next decade. So the current limitations might be potentially overcome going forward. But as of now, in my opinion, the technology is still at a point where visualization and interpretation is difficult. The resolution of a conventional high-frequency 2D imaging is still significantly better than what you can do with 3D. So I think that it will get there, but maybe not there yet. Thank you very much.